everybody. I kind of wanted to talk to you about a patient that I had come in last week, and she's a runner, and this has come up before, and I just thought it'd be fun to go back and kind of re-energize you all with how important hip flexors are, with how they attach to our diaphragm, which is a muscle that helps you and I to breathe deeply. A lot of times your hip flexor muscle, you guys, attaches on the upper part of your lumbar spine, and you have a left and a right one, and they come down from attaching to your lumbar spine and come down and attach to your thigh bone. A lot of times as healthcare practitioners, we all tend to focus on the distal attachment side on the thigh bone, and quite frankly, this is where a lot of runners or people that walk into the clinic will have a lot of tension, and we'll massage it, we'll foam roll it, we'll ultrasound it, and we'll stretch it. But that muscle always tends to have a lot of tension, like you're walking around with a clenched fist. It's always on. Well, that muscle is always going to stay on if we don't think about where that muscle attaches up at the top. And that muscle up at the top attaches way up high, and it attaches to your diaphragm. So if this is your hip flexor, and just excuse, I'm not a perfect artist, you guys. But when we have a left and a right side of our body, and all humans favor the right side of their body over the left side of their body. And if your pelvis comes forward and your ribs come up on the left side, the opposite is occurring on the right side. Ribs are down, pelvis is back. So on your right side, your right diaphragm is stuck in this position with your hip flexor. On your left side, you're stuck in this position with your diaphragm and your hip flexor. So on your right side, it's constantly on, it's stuck in this position, and your left side is stuck in this position. So our first goal when you come to our clinic, or what I did with my runner who had seen 4 different physical therapists and had seen some really great people to help out with muscle tension release, doing some ART, but she hadn't gotten any relief for a year. And the only thing that I did differently with her is that I worked on a diaphragm, putting her right side of her diaphragm in this position and her left side in this position. I flipped it, and she walked out pain-free. So what we need to do as therapists is just remember the proximal and distal attachment sites of a muscle. And on the right side, her right diaphragm and hip flexor needed to be turned off. And on the left side, those muscles needed to be turned on. So we actually lengthened her right side, or destabilized it, and helped stabilize or turn on her left side to help her walk out pain-free. And you can see a posture restoration therapist to get more clear techniques and how that was done. Have a great day.